Welcome to the InTouch Health webinar series. This is Rachel Gonzalez, and I will be your host for this webinar. Today, we are featuring Steve Cashman of InTouch Health, and he will be presenting on the newly expanded InTouch Health Consumer Solutions. Steve Cashman is the Executive Vice President of Marketing and Consumer Solutions at InTouch Health. In 1998, Steve co-founded an IT services integration company, Securicom, Inc. He was Chief Strategy Officer for Exceptional Innovation, where he led the adoption of the company's cutting-edge software platform into the healthcare, hospitality, and energy management marketplaces. He was recently CEO and founder of the telemedicine company HealthSpot, which was voted Consumer Electronics Association Small Business of the Year in 2013. Steve Cashman studied electrical engineering and business administration at Kansas State University. We'll begin our webinar shortly, but first, a few notices. You all have been auto-muted. If not, please make sure you mute yourself. At the bottom of your audience console are multiple application widgets you can use. If you have any technical difficulty, please click on the Help widget. It has a question mark icon and covers common technical issues. You can expand the slide area by clicking on the Maximize icon on the top right of the slide area, or by dragging the bottom right corner of the slide area. During the webinar, you will be able to enter questions in the Q&A widget. Questions will be answered at the conclusion of the presentation, so feel free to ask your questions at any point throughout the webinar. If a fuller answer is needed or we run out of time, questions will be answered later through email. This webinar will be recorded, and a copy of the recording will be shared with you later. The webinar presentation should last about 60 minutes, including time for questions and answers. And now, without further ado, here's Steve Cashman.
Thank you, Rachel. Well, whether you're an existing InTouch Health customer or a new entrant to Telehealth, it's an exciting time, and we appreciate you taking time to join us today. Macro trends in healthcare are rapidly changing the look and feel of what we have known as a traditional healthcare landscape. It's compounded by the fact that we have a rapidly aging U.S. population of baby boomers, an ever-changing payer landscape with increasing insurance coverage, with even the news yesterday of new entrants from Berkshire Hathaway, Amazon, and J.P. Morgan entering as a new insurance company. There's unprecedented pressure around margins and reimbursement and how providers conduct business. And with that, we have a growing physician shortage. Also, the changing healthcare competition landscape, including new direct-to-consumer providers such as the recent news from CVS and Aetna, have us rethinking exactly what the clean lines were that existed in healthcare 15 years ago. The shift from episodic care to continuous patient relationships is really returning to where we started around managing patient care and outcomes. But as the system has grown and the pressures have it has become more blurry. We have great strategies to solve these problems, whether it be patient-centered medical home, population health, or just general aspects of how to deliver continuity of care. The time is now in healthcare to make a change. 90% of reimbursement will be tied to quality value by the end of 2019. The number one priority for patients is more interactions with their providers to get a more personalized healthcare experience. And as we've seen in every other aspect of technology, it has enabled consumers and patients to have a more unique relationship with the companies and the people they do business with. We see a great alignment between both 81% of patients and of healthcare organizations that agree that the time is now to virtualize healthcare and to get healthcare in non-traditional ways. Healthcare is now a connected network, and what that means is the technologies are ready, the capabilities are here, the way consumers are accessing healthcare information on their mobile devices and through different applications is really causing a great amount of momentum and pressure on the system to go ahead and open up a framework that pivots from a traditional care model and extends that care model in the way people live, work, and use technology. InTouch's vision is a single telehealth platform. What we believe is that every line of service within a health system has components that would be more efficient if they were able to be extended and offered virtually. And so our vision with extending a health system, whether it be a specialty clinic, a private doctor's office, urgent care, a long-term care, even the home, is to create a technology platform that lets those work seamlessly. As you know, InTouch has a great history of innovation. The company started 15 years ago solving some of the biggest problems in healthcare. And as we started with telehealth, it was all about how did we save lives and how did we extend specialists out to community hospitals and out in areas where there weren't ability to those services, and many times it impacted folks' lives as they weren't able to get access to care. And so you've seen us over the last year continue down that acuity stream to offer more and more things where we can put care in more and more places. And so we're excited to continue that innovation into the next stream of healthcare. And so over the last year, our CEO, Joe DeVivo, was out in the marketplace a lot, and hopefully many of you got to attend our annual forum. And Joe spoke about how he had heard from the customers and where we needed to expand upon what InTouch's core capability and strengths were with providing a quality infrastructure and operating system that worked every time to help with life-critical events. And so we've really looked across that care continuum, starting in the home and moving across everything from a GP's office to what happens in transport to what happens after an event, all the way down to home health and monitoring. And you've probably recently seen our announcement to partner with Vivify even to close out on the remote patient monitoring end of this spectrum. So you probably saw an announcement about a month ago that we made an acquisition, and that led you here to this webinar. So we're very excited to announce at the first of the year that we made a move into the consumer space and acquired a TrueClinic. We've got a quick poll question here for you that we'd like you to answer, if you could take 10 seconds. So TrueClinic is not just our neighbor at the top of the class list. They're actually very much in culture alignment with InTouch, and that they've built technology that truly extends and has capabilities to radically transform the way providers can deliver care. And so as you saw InTouch at the top of the list, and what we do and what we provide with you if you're an existing partner, TrueClinic had very much the similar aspects within the consumer segment. They very much valued their relationships with health systems. They focused heavily on delivering what they promised to them and getting that out to the world, and they had very happy customers. So you also probably noticed yesterday's class report that was released, and we're very proud to announce publicly for the first time today that InTouch was selected the #1 virtual care platform by class. This didn't happen by chance, as our founder Yulin Wong set out many years ago to deliver a technology that would work in every instance and to work heavily as a deep partner with our health system customers to really deliver something that they could count on just like any other tool they needed to help save lives. And so we're very proud of this award, and thank you guys for participating and help us create what we have today at the InTouch OS. So focusing on delivering to care, when we looked at the consumer market, and we heard from a lot of you guys that there was a lot of noise in this space and a lot of things that had been rolled out, we got hyper-focused on, what were the key things that providers wanted to do to extend telehealth down into the consumer segment. One of the first items that came up was really the ability to just facilitate 24/7 on-demand care. We've largely solved this through the proliferation of urgent cares in the light hours of the day, but really being able to extend that. We also heard that it was really important to offer continuity of care and not really fragment care, and that, continuing to build a great patient-provider relationship was something that was very important. And being able for providers to extend themselves via telehealth for lower acuity things was important to their customer base. We also heard about being able to scale on an enterprise-wide basis with the InTouch operating system, and that reliable platform we had was very important. And so the ability for a provider to have single sign-on into one tool set, have a consistent UI, and not have to jump around many programs and systems and figure out how they worked all the time to deliver virtual care was something that you guys were already touching on. So also the ability to greater align this with value-based care initiatives where risk is being taken, or pop health contracts and ACO movements happening, and how this could be done in a very integrated sense to the types of programs that were being built into the EMRs today. We also heard a lot about how to engage populations and optimize physicians. And we also, took a large understanding of the investments and the innovation and the expanded offerings both the health system and InTouch would need to take to deliver on some of these requests. So with TrueClinic, now InTouch Health Consumer, we're able to do several things that we weren't able to do before. And so we're excited to talk about those today and give you a little bit more of an idea what those are. The first one is we do have two consumer solutions. The first one is the ability to create an on-demand capability for your health system, whether that be embedded in your website or your app, but having a clear pathway where consumers can get quick access, go through an automated intake process, and get access to a provider for low acuity items. And we are launching that solution. We also have the ability when you have existing patients, and we know existing patients only make it to the doctor about 3.3 times a year, but when we get into chronic disease patients and other things, we need that ability to touch them and check on them sometimes as frequently as monthly. And so the quick ability for a provider to extend himself virtually to his patients with ease is another capability that we have. Additionally, with the TrueClinic platform, we ended up with some specialist capabilities. And we know site-to-site has been a big issue just for communication and collaboration and specialist hands-offs, employee programs. And so we now have the ability off any consumer device inside medical facilities to another facility or even within the same facility to provide a really easy tool to make that happen for you. Additionally, facility to the field is a way that we have been delivering stroke and other high acuity programs as far as care delivery. But what happens for lower acuity cases where somebody may be in an ambulance and intake, and it would just be nice to check them in and touch base with those people operating in the ambulance on the way to a facility. And so we do have that capability as well as when somebody checks out or is moved to another facility and that we really want to create some continuity is there. So we're going to explore those a little more and talk about what we can do there. So we're going to start with direct-to-consumer. Direct-to-consumer is usually consumer-initiated care. And the capability we have within our new InTouch consumer framework is pretty broad, and we'll talk a little bit later on about the technology and why it can be deployed so many different ways. But what direct-to-consumer gives us is whether it's with a partner such as an employer that you would like to offer care to their employees, or whether it's simply on the website, we now have an offering that you guys can create your own patient journey right on their mobile phone, right on your website, right within an application for numerous lines of care. It's configurable, it has different waiting rooms, and you can help bring a consumer in and on board. And many people call this a catchment solution, but this is something that we have many health systems that really want to put their brand out there in the market and provide that ease of use if that's where a consumer's at in their adoption. We're now going to watch a quick video of that experience.
With everyone using their smartphones and personal devices to work, bank, and keep up with friends, it makes sense that they would reach for it when they need to connect with a doctor. It's next-generation healthcare that extends outside of your four walls, and that's where we come in. Built on our tried and true cloud-based network, the InTouch operating system is a flexible and modular backbone for any telehealth use case and any workflow. Created to unify your virtual and in-clinic care, our direct-to-consumer solution lets people reach you from any device and connect directly to your care teams and providers. Its modular design allows you to configure your patient intake process to fit your existing workflows, automating your scheduling, eligibility verification, payment collection, forms, and signatures, freeing up precious staff time and reducing data entry mistakes. Designed specifically for healthcare, the InTouch OS is HITRUST certified and HIPAA compliant, so you can rest easy knowing that your data is secure. Our technology rides above and across your EHR systems and devices, allowing you to focus on the one thing that really matters, your patients. We're committed to making next-generation telehealth easy, and we're confident your patients will love it.
So you can see it's a very easy to use journey for the patient and the provider, and opens up a whole new world for a health system to extend themselves. The next piece we're going to talk about is direct-to-patient. Direct-to-patient's unique that most health systems and providers already are full, right? We talked about a shortage of providers out there. So how do we optimize your time? How do we get you to the work at the top of your license and really be efficient in how do you deliver things? And so direct-to-patient's a new offering from InTouch Health that will allow you to extend yourself out to folks that can't make it into the office or maybe aren't going to make it into the office just because they're feeling better, and yet you need to manage their outcome. You need to manage seeing that you can close out a procedure or something and see that they're doing better. So direct-to-patient obviously has a lot of different opportunities of where you can manage a patient for different service lines, but really easy for follow-ups, chronic disease management, outcomes, and maybe just medication refills and simple things based on the acuity level where you feel comfortable today with virtual care. We're also now going to show you a little bit of that patient experience.
The best virtual care happens when technology enhances the connection between providers and their patients without getting in the way. The InTouch operating system, purpose-built for more than just teleconferencing, your single telehealth solution for any use case and any workflow. Designed to unify your virtual and in-clinic care, our direct-to-patient solution makes healthcare easy. By providing a wealth of touchpoints for providers to engage directly and more frequently with their patients virtually through any device. And because it's telehealth made easy on a single platform, care is more efficient, more frequent, more accessible, and ultimately more human. Our software's modular design adapts to the way your care team works and streamlines the clinical process, customizable down to the smallest detail, giving you full control over how you virtually care for your patients. Designed specifically for healthcare, the InTouch OS is HITRUST certified and HIPAA compliant, so you can rest easy knowing that your data is secure. And with technology that rides above and across your EHR systems and devices, you can concentrate on the one thing that really matters, your patients. Focus on delivering amazing care. We'll take care of the rest.
So you can see our ability to expand patient access is pretty straightforward in two different solutions where we can help really grow the business and bring new solutions to the table. We want to focus a little bit on ease of use here because as InTouch and as health systems move into the consumer world of applications and things, making these solutions extremely easy to use, up and down the acuity tier, as well as up and down the patient education tier, is important. And so we're going to walk a little bit through some of the capabilities of our new solution, and one of them I'm going to start with is just the simplicity. At the most simplistic level, we have the ability for this to work just like a text message. where a text message would just simply be extended out to a patient, and all they have to do is click on that text message. It could also be an email, and they're into a session right there, and or into a workflow to verify who they are or ask them questions or whatever the patient journey is it's defined. So there is ability to embed in apps and websites and other things, but what we have seen, and I was actually on the phone with a group yesterday and talking about it, especially as we move to the Medicaid customer, especially as we deal with other folks that are elderly and they're not, how many apps can you really have on your phone, and especially when you don't use them frequently, and logins and everything. And we've really eliminated all that complexity, but we also can be fit inside of that world if that's where you're at today. So making that easy is important. To date, we've had 95% patient adoption and 90% patient satisfaction when rolling this out. Another piece that's really important to this when we move into the consumer world is self-guided patient check-in. And I think, when you generally sit down and do a focus group with a bunch of consumers, regardless of education, income, or age, they say, why can't this work like the airport? Why can't this work like the ATM? Banking and airlines, and despite their not on-time arrivals in the airline world, the check-in process is usually pretty easy. Picking a seat's pretty easy. And one of the things that we have through the acquisition of TrueClinic that we've added in the InTouch Health consumer portfolio is an intake capability that's self-guided check-in. It's a configurable journey. You can configure many different journeys based on the number of service lines and experiences you want. We'll talk a little bit about EMR integration next, but that journey can be as simple as identifying themselves, but it can be as complex as digitizing everything that happens at a reception counter today. One of the customers today, Evergreen Health, that is deployed just the intake portion, which I will also say that what we can do with intake is what we see as the front leg of a journey of building a virtual front door to your health system. It can be run on its own before the telehealth module's even turned on. So we do have folks using that, and we've seen dramatic drops in wait times and literally thousands of folks using that versus paper to check in. So along that journey is everything from time scheduling, but to eligibility, to payment, to medical protocols, to consent forms. But really, the journey is configurable based upon your vision and the different service lines. And so we really are excited to have that flexibility out there to offer a new front door into the health system. EHR integrations is something that we're very excited to see the way the technology was built and the flexibility that it has. So we just talked about that journey, and so we kind of have the pre-arrival, we've got the actual visit, and then the post-visit. And really the new consumer offering has a lot of flexibility there that we can line up with the ADT through standard SIU and CCDA and other interfaces. So whether it's synchronizing scheduling to where the doctor only has one schedule sitting in front of him, or whether it's lining up demographics and other things as we're checking in to verify who the patient is, or whether we're bridging between two systems where maybe an affiliate site is not on the same EMR as a health system site. We have the ability to do some notes inside of that, move that around, and all the way down to the new standard of FHIR with discrete data. So really making this a seamless experience for your providers and for your system and data is a key part of this new framework. Got another poll question for you. Appreciate everybody helping with those. So I wanted to talk a little bit about, TrueClinic and why they were at where they were at in class, and why that's complementary, and how we're already seeing customer adoption even in the first month after acquisition by InTouch Health's customers. A few of their big customers, University of Utah, Evergreen Health, and Sharp, very amazing health systems. but we'll just take a little walkthrough. University of Utah has over 500 clinical users using the platform today, 60-plus connected facilities in 6 states, 90% patient satisfaction, patient satisfaction, 95% patient acceptance is using it as a front door into the system. It's across 60-plus specialty lines. So they have basically embedded this in almost every practice they have out there in some way, shape, or form to either optimize staff time or extend access. Evergreen in Seattle, as I mentioned, is using this purely for patient intake as a first step, and they've now moved to where 20% or a fifth of their patients are checking in before they get to one of their facilities. And this is not just check-in for telehealth, it's just check-in in general. They've been able to reduce the size of their waiting rooms by 70%, and they've also they're at the rate now where they're doing over 5,000 automated patient check-ins a month. So 36,000 of them last year. So a lot of efficiency in data input and documentation and patient time, and really an exciting place of what's happening in healthcare. Sharp is a customer that, another customer that InTouch and TrueClinic had in common. And, they've really grown their practice out there, started with some behavioral work, and they're seeing a dramatic savings, about 50% savings per telehealth visit. They ran a large RFI and RFP and ultimately had selected this platform as #1 and rolled it out. And they're really growing the number of visits and sessions every month. So excited to see that, InTouch has always had a culture of partnering with the health system and really helping them expand their care and see that it's working and grow from that experience. And that's a similar culture we brought in from TrueClinic, and we found that with the customers. And so we're going to carry that reputation and that experience and that expectation that you have along with rolling out consumer for you. So, to touch on some of the highlights of what we just talked about, really this is a pure tech play. It's a software-based application that sits in the cloud. It's ultra configurable, so it can fit in a lot of places and solve a lot of problems. Obviously, we touched a little bit on the patient self-service, the automated check-in and scheduling, the ability to work on all smart devices, that it's a modular platform that really adapts to your existing EMR's workflows and processes and just extends them in a virtual way. It does offer multi-person interactions, and as you look closer at the system, and the ability to add a second provider in a session via text or an email or a family member, or even do shared visits or something that are conveniently built into this. The easy use is really there. We do have things like eScripts and other stuff on the back end if we are bridging between EMR systems. It's all cloud infrastructure, so there's no software to install, update, nothing to keep updated in apps, things of that nature for the consumer because of that. Obviously, InTouch was very excited this year to announce that we're HITRUST certified, and we'll be extending this technology into that as we integrate it throughout the year. Things like integrated billing, we're very unique on the payment side on the front end, the eligibility side, where we're not trying to replace the billing system that you have in the back of house. We're really an overlay on the top of that where we can just inject that data into your system. EMR integration is really the fundamental way this API-based system is built, and keeping that clean. And then the ability to scale this. The customers range from really small regional primary care practices that maybe had 8 or 10 offices, and that they realized that, man, it'd be nice if we had a virtual front door for our patients for nights and weekends, and we could kind of do cross coverage for each other and really do a good job of containment, to large health systems that are injecting it into every service line, whether it be to carry referrals over from primary care and urgent care offices, or inside of patient management with follow-ups and readmission checks, or inserted into RPM programs, or just the normal consumer world that we've seen kind of in Telehealth 1.0. Additionally, we have priced the platform and the technology and the InTouch consumer offering at a very, low price, grow a rate that will grow with you in your practice in this space. So we're excited to be able to bring that technology out there with a low barrier to entry that can add a lot of value. We're going to move forward a little bit and talk about our vision. So where InTouch Health is going really, what we built over the last 15 years was a telehealth operating system. And the reason we're number one in class is because our partners and the health system customers we have continue to push us in innovation, and we pushed ourselves to really build something that worked every time. It wasn't just a video chat, and it wasn't just a piece of hardware or a card out there. It was really an entire operating system that we not only delivered turnkey and made it work, but we actually monitor. We have on-demand support. We're watching for devices and battery failures and really making that whole ecosystem be something that was an extension for the provider. So we're really excited to extend that operating system as we integrate TrueClinic to now have a consumer offering. We have modules on that operating system that range from intake that you saw to coordinating capability with scheduling, smart notes, the ability to document, obviously imaging, and a new addition that we're really bringing out around analytics, which we have in this piece. So you really can see how your program's performing and how long patients are waiting and how long sessions are taking and really how to optimize that. So we're really excited to integrate this company in 2018 and put it onto the operating system that many of you on the call, I think, have grown to know is a very reliable and trusted part of your ecosystem. So we're excited to enable you to deliver high quality and reliable virtual care at any time, anywhere now through InTouch Consumer. It is really a breakthrough telehealth platform. We have unparalleled connectivity solutions now that range from high acuity to low acuity. And we're the number one vendors in class at the highest ranking in our award and in their follow-up as an early entrant to the class report. So we really appreciate your time. We are going to move to Q&A if you want to bring in through that, and we'll move to answering some questions. We're going to start with a little bit of a poll here again. So your final poll, and then we'll open up the Q&A session. So if you wouldn't mind answering another quick question. And we know many of you would rather meet with our field team and our reps. We are having all of our reps and field team in next week for a full week education session on this technology and many others that we're bringing there so they can be experts for you out in the field as they have been and a trusted, reliable part of your team. But in the meantime, if you want to schedule a demo, if you will drop us an email at feedback@intouchhealth.com, we will get those out to the field teams and quickly follow up and schedule one-on-one demos and sessions to answer questions. We're really excited about the amount of energy that's around this technology and InTouch expanding. We literally in the last 30 days have already had a few folks come on board from our existing customer base that are really, I think there was a SAGE report out there that talked about 80 to 90%, ATA shared this at the last one, 80 to 90% of you intend to roll out some sort of consumer solution in 2018 or 19. So we know everybody's got this on their plate, or at least a lot of you do, and we're anxious to help solve that. So thank you for all your time. We're now going to go to the Q&A session, and all of you should have that ability, and we'll bring Rachel back on.
Thanks, Steve. So we're getting a few questions funneling in now. We're going to start with the questions, but feel free to continue asking questions, and we'll get to them as time permits. So the first question we have here is, when are these solutions available?
So we have about 20 health systems using it today. TrueClinic was an existing company, and so we're really just integrating this into the InTouch OS. So we are ready to go now and are bringing customers live literally week by week. So they're available to the marketplace today.
Great. Next question. Can you please clarify the key differences between direct-to-consumer and direct-to-patient?
Yeah, so direct-to-consumer is typically a new patient, and it's consumer-initiated. So, it's where consumers decided, hey, I'm going to go find care, and I've went to the website of maybe your health system, and they're initiating coming into the system as a new patient. Direct-to-patient is really somebody who's already in your system, and you guys are choosing to offer this as a service for maybe visits that are in bundled payment, or folks that don't have good transportation or live a long way from a facility where there's a use case such as a behavioral health or maybe a follow-up visit where you can send the invite directly to the patient. It could be at time of discharge. It could be when they're in an office and you put them on a new med and you just say, hey, I'd like to see you in 2 weeks to do a follow-up. Do you mind doing that virtually? And if you would, you wouldn't have to come into the office and wait. I'll just send you a text on this day at this time or an email, and you can click on it and we'll see you that way. So that's the main difference. One is a new patient and consumer initiated. The other is an existing patient where you're extending that and it's more provider initiated.
Great. Next one is, for creating a dermatology clinic using the platform, is the platform capable of being able to capture images either in real time or stored and be able to add those images to the notes or documentation platform?
So that's a devil in the details question. The general answer is yes, that we can do some of those items. What I would love to do is have us specifically demo what the capabilities are within the notes and other items, if you wouldn't mind sending an email on feedback. But yes, we see that as a vital part of the capabilities.
Okay. Do we have to use our physicians or your physicians when we use the direct-to-consumer solution?
So we believe firmly in helping providers extend themselves within their capabilities, but we also have partners that we can bring to the table that some of the health systems we already have live are using to bring additional physicians or physicians to the table if you don't have the capacity today. So we can do either or.
Okay. Can the platform handle sending a single video invite to multiple patients that all join the same visit at the same time?
We have that on our roadmap, and that will be available in the next 6 to 8 weeks. We are excited about that, and it's something that we can do today. And if you want to follow up on feedback, we'd be happy to send you the feature function of that. But that is something that we're going to release very soon. Okay. Next question is, how could we leverage the InTouch functionality using the True Clinic principles within Epic using MyChart rather than using this as a separate platform? That's actually how most of the customers are using it, would be embedded. So, obviously everybody's Epic implementation is a little bit unique, but it would start as simply as inside MyChart providing a link and doing an integration with the Epic system where we could have a patient journey on the consumer side to check in and match up that patient, and then really provide the link to the visits and stuff within inside the Epic calendar system so that this could really be embedded, and then doing a pretty tight integration on the back end for documentation to where that could all get closed out within the Epic framework. We're also working, as I think everybody's heard in the industry, with the Epic App Orchard and that concept that Epic's brought out to really create an environment for things like this to be more tightly coupled with Epic. So that's definitely an area that we're continuing to work with them both on. Okay, next question. You indicated no app is needed. Is that just an option, or is there no app at all? We can do either or. So what we have saw is, 3 to 4 years ago, if you look at the data, and I was just on with this health system CIO yesterday, I'd seen similar data. Apps were a big thing, right? And then you got a phone and it got full of data, and you had to start figuring out which apps to delete that you use the most and stuff. And then as we moved down the income level and education level food chain, and up the age range, these things are not as common as far as apps. So we don't need an app. It's as simple as a unique web link for every visit or text link. But we also realize some people have built and invested in app frameworks where you can actually build that into your app. So we're flexible based on your strategy, and frankly, both can be deployed, and it just can be a matter of how you're using it.
Okay. Does this also ride on the InTouch cloud?
So our roadmap today with the InTouch Cloud is that we will integrate this throughout the year to make what most of our customers have been using in the OS and that video and cloud platform ubiquitous to this solution. It was unique that the technologies within TrueClinic are the same technologies that we were working on internally in R&D for the next phase of the cloud. So that will be an integration that happens. Today, the consumer offering sits in the AWS cloud, the high reliable private virtual network cloud there. So we're quickly moving to integrate the solutions to where they are seamless from both an experience as well as a technology stack.
Next question is, how is the compatibility with peripherals on mobile devices?
So, this is an area that's changing a lot as you see a lot of new startups and a lot of innovation happening. Today, we have the general basic capability through the USB port to take in USB-based peripherals that are either audio or video-based. We will continue to evolve in that area, but the market's changing very rapidly. Most of you are aware how the FDA has changed the definitions even for MDDS in Class 1 and Class 2. So that's an area that we definitely see, that we're going to continue to innovate on. And, there's a lot of new devices coming out, and you've probably seen many of those. Very excited about what's happening in the medical device peripheral arena, and that's something that we intend to leverage with this platform. And it does have the framework in it to extend itself to those type of devices.
Great. If the patient is simply clicking on a text link to join, are they immediately joined into the visit, or are they placed into a workflow first to create usernames and passwords?
So the answer is the system is very configurable, and you get to find that journey. It is as simple as I can send you a text and you can bounce right into a session. It is also we have the ability to support codes if you're using some sort of patient code in your system. We also have a configurable workflow journey that text could simply start, a journey that says, verify who you are, verify your demographics, take payment at that point in time. So the system is configurable. I would really love to demo that to you if you would come through feedback, and we can actually show you how flexible that patient journey is. So it is both. I know that's probably not the answer you're looking for, but since we're not having an interactive conversation here, all I can say is yes. It can be as simple as a one-click into a session, or it can be a journey that click just starts that could go through a whole intake process.
Okay. This one is a two-part question. First part is, can the platform provide secure text messaging? And then part two is, if so, are those secured messages stored in the cloud so they can be either inserted into notes or be viewed by legal team if there are any potential lawsuits?
We have not ventured down that path for the exact reasons that you have here. We are continuing to look at secure messaging between the patient and the provider and how that can be done, but that is currently not part of the consumer offering.
And then, is the platform WebRTC based?
Yes, it is.
Okay. So those are most of the questions that have come through so far. We'll give it a couple extra minutes if any of you want to get any last-minute questions in. There are a few questions in here that will require a lengthier response, so we'll respond to those via email after the webinar. So we haven't forgot about you. And any last-minute questions, feel free to drop them in now. Okay, I'm not seeing any additional questions. So with that, that will conclude our webinar. We'd like to give a big thank you to Steve for today's presentation. Oh, one more question, sorry. Can the platform be branded with logos of the hospital or health system?
Yes, our vision is purely a white label platform. This is an enabling technology. We actually have the system's built around virtual waiting rooms, so you could actually have numerous brands within the whole instance of what we would set up with you. And so if, for example, if you wanted the main health system brand out there on the early pieces, but as you worked off into like a dermatologist clinic, or you moved off into a primary care group and they had their own branding, or even maybe they're in different regions, we can build all that within the tree structures and branding pieces of it. So we really want this to extend your brand. We believe that brand and what that brand value is in your health community is significant to those consumers versus maybe some of the generic brands of telehealth that are out there today. They also know when they use you that there is continuity of care, and if you can't solve what they need through virtual health and an inpatient visit's needed, that there's a pathway to get them healthy. And so we very much encourage and want this to be a branded experience and an extension of your brand and your meaning of your brand to that consumer.
Okay, another question just came through. How do you accommodate for patients that require interpreting for a language or are deaf or hard of hearing?
So lots of intricate details there. For a language, we have the ability to just add an interpreter right into the session. So one of the unique abilities inside of this framework is that I could be in a visit with Rachel right now, and if I need to bring in an interpreter, or I wanted to hand her off to a specialist or referral, I can just quickly type their email in or their name in the directory and send them a link and add them. I can even leave the session then or anything. So we have the ability to do that on the fly to bring in a third party. And then obviously, with the deaf or hard of hearing, there are other kind of peripherals in the consumer world that can be out there, from amplification and other items that are there. So would be happy to follow that up as well and understand more of the problem that's trying to be solved.
Great. And the last one here is, do you provide SDKs and APIs?
So yes, the whole system today is API built. All of these parts and pieces can be turned on and off in the software, and it's an API and web service architected system to enable that configurability. We don't have a true full-blown SDK today, but we are actually working with a couple groups that are doing some unique development of their own and would like to really use all the functionality inside that. So I would encourage you to probably come through that feedback loop and us to have a one-on-one understanding whether an API is going to be adequate or if a true SDK is needed. But this is very much built with that thought process in mind.
All right. So it looks like that is the last question that came through. Thank you again, Steve, for your presentation today. If you do have any additional questions or would like more information, please do reach out to us using feedback@intouchhealth.com. This webinar will be sent as an on-demand video link within the next 48 hours. So that is all. Thank you for your time, and have a great day.